students, welcome back to Easiness, where nursing education made easy. So, are you stressed about your upcoming exam? Don't worry, we are Easiness here to guide you and to give you some more important topic for your upcoming exam. And let's come together and hack the exam and crack the exam with a very good score marks in your exam. So Easiness will help you for the preparation as well as for giving you some more important questions as well as the topics. Okay, so today I am dealing with the Nursing Foundation 1 and Nursing Foundation 2. I know in this situation every subject is making a khichdi in your mind, right? But don't worry, Easiness will help to make the biryani from khichdi. So let's start today's session from the Nursing Foundation. So mainly in this session, I am giving you some more important topic which will be definitely come in your upcoming exam. And from this session, you will learn like how to write the exam as well as how to crack the exam. And from this the topics you will can able to answer from the fill in the blanks as well as like multiple choice questions and short essay, long essay, everything. Okay, so let's start about today's session. So first I am diving in the Nursing Foundation 1. Okay, so first see the health. What is the definitions of the health? So based on the WHO, health is nothing but it's a state of the physical, mental and social well-being and not merely the absence of disease or infirmity. So as we know the health definition, so mainly is the health is nothing but it's a dynamic balance which is mainly balancing between various factors which is include physical fitness, mental illness, mental balance, emotional stability, social interaction and environmental conditions. So it's achieving and maintaining the good health which is essential for leading a fulfilling as well as the productive life. So now come to the definition. Health is a state of complete physical, mental, social well-being and not merely the absence of disease or infirmity based on who. So now come to the philosophy of the health. So what is the philosophy of the health? Health is a fundamental human right. It's an integral part of the development. It's central to the concept of the quality of life and health is a worldwide social goal. So if your health is not healthy, whether your life will be quality means you can able to spend the quality of life? No, right? So health is one of the factor which you can maintain and for that you can able to maintain the quality of life also. So that is the philosophy of health. So mainly from this health you can get the 2 marks question, that is definitions of the health. Okay, next come to the concept of the health. So there are so many concepts. First is biomedical concept, next one is ecological concept, then psychological, psychosocial concept, next holistic concept. So one by one say biomedical concept. So biomedical concept is nothing but is one of the most traditional approach for understanding our health. So what is the concept of the bio plus medical? Means it's combined the biology plus the medical science. So it's mainly focus on the biological as well as the physical aspect of the disease and which is considered health as absence of the disease or infirmity. So now come to the ecological concept. Ecological concept is nothing but which is view as a health is dynamic equilibrium which is between the humans and their environment, which is emphasizing the interdependence of various ecological components. Next one is psychosocial concept. So it's nothing but it integrates both the psychological mind and emotions and then social relationship as well as the environmental factors. So which is recognized health is not just the absence of disease but a dynamic state which is influenced by mental as well as the social well-being. And last one is the holistic concept. So it's mainly refers the comprehensive approach for the health which is considered the whole person, not just the disease or symptoms. It recognizes the interconnections of the body, mind, spirit, environment which is achieving the overall well-being. So from the concept of health, what question should become? Like define the health and explain the concept of the health. It might become in the 10 marks, it might become in the 5 marks as well as sometimes they are asking you the questions like explain the biomedical concept or explain the ecological concept in the 2 marks. Okay, so from every sector this is the most important questions. From every sector you can get the at least 1 questions. Okay, Now come to the dimensions of the health. So dimensions is physical dimension, emotional, mental, social and spiritual. So what do you mean by the physical dimension? Which is refers the conditions of the body as well as their ability for the functioning optionally, and it also includes aspects such as nutrition, exercise, sleep and then immunity as well as absence of the physical alignments. Now come to the mental health. So mental health is nothing but like emotional well-being and psychological stability as well as the cognitive functions. So mainly it includes with the cope up with the stress, maintain positive relationship and it's also experience a sense of purpose and satisfaction in the life. Next come to the emotional health. So what do you mean by the emotional health? It refers to the understanding and managing the emotions effectively, and also it's involved the recognizing as well as expressing the feelings, developing emotional intelligence, dealing with the stress with a constructive manner. Next is the social health. So social health which is pertains to quality of the individual's relationship and social interaction. Also it includes the ability from the meaningful connections, maintain healthy friendship, participate in the supportive community. So same from the dimensions of the health, either specifically one they are asking you what is a emotional dimensions of the health, what is a social dimension of the health, or else they will ask you in the 5 marks or the 10 marks question explain the dimensions of the health as a clump questions like define health and explain the dimensions of the health. Okay, so now come to the next question, that is spiritual dimension. So spiritual dimension which is does not necessarily refer to the religion beliefs but also involves finding the purpose, meaning and values in the life, which is related to the personal growth, self-awareness and sense of the connections to the something greater than oneself. From this you can get some like fill in the blanks also. Okay, so now come to the next question, that is illness. So what do you mean by the illness? Illness is nothing but it's a state where the person's physical, emotional and intellectual as well as the social development and the spiritual functioning is becoming the diminished or going to be impaired. So it's also condition which is characterized by the deviation from a normal healthy state. So that is the meaning of illness. Okay, what are the types of illness? That is acute illness and chronic illness. So in this the illness, that is some causes and risk factor is there why the people or the person is developing illness. First is the behavioral risk factor, as example smoking, excessive alcohol consumption as well as unprotected sex. Next one is the psychological risk factor. So under this like being overweight, high BP, high cholesterol. Next one is a demographical risk factor. So under this age, gender, population, occupation. Next one is the environmental. So under this environmental, sanitation, clean drinking water, air pollution and risk in the workplace. Next one is a genetic. So under this genetic, muscular dystrophy, cystic fibrosis, asthma as well as a diabetes. So now come to the impact of illness on patient and family. So first is the physical health of the client. So physical health means if the patient is not like healthy, so whether they can fulfill their goal or fulfill their quality of life, no. Next mental and then emotional health which is interconnected with our physical health. Next one is the family as well as the social health which is mainly mentoring the social well-being and the spirituality of the person. Next come to the Maslow hierarchy of the needs. So from the illness they are asking you in the 5 marks question what is the illness, what is the health illness continuum. So that time you have to explain everything. Okay, so now come to the Maslow hierarchy of the needs. So this is also one of the most important questions for the 5 marks or 2 marks questions. So Maslow hierarchy of the needs is mainly they proposed based on the basic needs of the human being. Okay, so it's proposed by the Abraham Maslow. So this is also one of the important questions for the fill in the blanks. Okay, so what is who proposed this Maslow hierarchy of the theory? So that is Abraham Maslow, and he was a psychologist. So mainly this theory was based on the human motivation. So this theory they are suggesting the human needs which can be categorized into the hierarchical structure. So based on the hierarchy, based on the human needs, they proposed a hierarchy. So based on that they are going to mentioning the theory. So with some some needs being more fundamental and prioritized over others. So first is the physiological needs. So there are the more fundamental needs which is necessary for the survival, include like food, water, shelter, air, sleep, as well as a basic bodily function. Now come to the safety and then security needs. So safety and security needs is nothing but when this physiological needs is going to be met, an individual seeks safety and security. So this person include like a personal safety, financial security, job stability, health security, as well as a safe living environment. Next come to the self-actualization. So at the top of the hierarchy is the self-actualization, which is mainly refers to the realization of the one's full potential and the personal growth. Okay, and it's also going to involve the pursuing growth, a goal, fulfilling the creative and then intellectual capacities, and reaching a state of self-fulfillment and then personal satisfaction. Okay, so why this question is important? Because they are mainly focused on human motivation. Sometime in the exam you can get these questions like explain the motivational theory. So same the answer goes to Maslow hierarchy of the needs. Okay, so sometimes they are asking you in the exam like what are the components of the hierarchy of the theory. So that time you have to give this needs: physiological needs, safety, security needs, self-actualization. Okay, now come to the one of the most important question or topic, that is levels of prevention for Viva question, for 2 marks question, 5 marks, as well as the 10 marks. So what are the health, what is the prevention of the health, and what are the levels of prevention of the health? Sometimes they are asking you as a club question, otherwise separately also or individually they can asking you what are the levels of the health. So that time you have to give the answer primary, secondary and tertiary, means 3 levels. So primary prevention, which mainly focus on preventing the onset of disease or injury before it occurs. As example, immunization, health education and lifestyle changes. Means before onset, starting the onset of the disease, means before the entering of any kind of the microorganism or the bad product which is not suitable for our health. So what are the things we are taking, means what are the measures we are taking for prevention. So that is called primary prevention. Next come to the secondary, means the microorganism or the bad product is already entered in our life, but onset of the disease is just started, not that much progressive. Okay, so that time what should be the management to prevent the complications of that particular disease. So that is called secondary prevention. So the level M's which detect as well as the treatment of the disease as soon as the early phase. So what will happen? You can prevent the progression, regular screening, early diagnosis and prompt medical intervention. Now come to the tertiary prevention. Tertiary prevention in the sense like at the after the onset of the disease, what should be the management? What should be your role to prevent this kind of the complications or to managing those diseases? So that is called tertiary prevention. So this level concentrate on minimizing the impact of established pre-disease as well as prevention of the further complication or the disabilities. As example, rehabilitation, ongoing medical management and supportive device. So now come to the healthcare agency. So in our India, many healthcare agencies are there like hospital, clinics, rehabilitation center, extended care and then hospice. Okay, so now first we will see about the types of the healthcare agency. Okay, so first is the hospital. So hospital is nothing but which they are providing the facilities as a wide range of the medical service from emergency care to the surgeries and especially the treatment. Now come to the hospice care. So hospice care is nothing but individual with a terminal ills and then cared for with the comfort or the support provided during the end of the life stages. So what are the difference between hospital and then hospice care? Hospital is for every patient, okay, from the primary level till the end of the stage, and they are also providing all the treatment, surgery as well as the specific treatment. But for the hospice care is nothing but it's only for the terminally ill patient, and they are only giving the care during the life stages, means end of the life stages period. Now come to the extended, so which is mainly providing the medical care as well as a support service for the people who require the long-term care due to the chronic illness, impairment and recovery for the surgery. Next come to the clinic. So clinic is nothing but small or medical facilities which is specially particularly short of the device such as dental, optometry or the women's health. Now come to the rehabilitation center. So mainly it's concentrated on the assisting patients in the recovering and regaining the functionality through following the surgery, injuries or the disease. Okay, so what are the questions it will come? What are the types of healthcare agency in our India? This is also one of the most important questions, frequently asked questions, types of healthcare agency in our India. So you have to give this answer, okay, and with the proper explanation. So now come to the hospital. So that is also one of the most important 5 marks question as an individual healthcare agency in our India. So define the hospital, what are the structure of the hospital, everything. So let's see. So hospital, so first we have to know what is the meaning of hospital. Hospital is nothing but it's a medical organization which provide a wide range of the healthcare service for the patient with a diverse medical conditions such as the diagnostic treatment, procedures and then emergency care. Now come to the types. So what are the types of hospital? So mainly these types of hospital based on some principles. Okay, so first is based on the bed strength. So based on the bed strength there are 3 types of the hospital. First is small, less than 100 bed, medium 100 to 300 beds, sometimes 500, and then large, more than 500 beds. Now come to the based on services rendered. First is service routine care for medical, surgical, gynecological, obstetrical and then pediatric. So now come to the specialty which is providing a particular specialty such as maternity, ophthalmology and then cancer. Now come to the super specialty. It's highly sophisticated diagnostic equipment, therapeutic equipment, skilled staff and as example cardiac surgery, neurosurgery etc. which is coexist in the same hospital. So that is the types of hospital based on bed strength and based on the service rendered. Now come to the based on founding body, like government means which received from the government sector, central or state. Next municipality, local self-government, then trust which is a charitable or the same charitable hospital which is the charging moderate to nominal charges and private users pay for each and every services. So these and all the types of hospital. This is also is one of the most important topic for exam as a individually explain the types of hospital for the 2 marks or 5 marks questions. So now come to the healthcare teams. So what do you mean by the healthcare teams? This is important for the 2 marks questions. Explain the healthcare teams. So first is physician who is the main responsible for medical diagnosis, detections of the therapy which is required by the sick person. Now come to the nurse which is the personnel who provide the nursing service for the patient as well as for his family. Now come to the dietitian who supervise the preparations of the meals for the patient prescribed by the doctors. Now come to the physiotherapist. So for the physiotherapist it helps the people improve their physical movement and manage the pain through the exercise as well as the therapies. Now come to the medical social workers. So problems like finance, counseling, marital problem, adoption of the child etc. is going to assist by them. Now come to the occupational therapist which helps the people improve their ability to do the daily task and regain the independence after injuries or the health issues. Now come to the paramedical technology. So they are the laboratory technician who examine and study the specimen like urine, feces, blood culture as well as the discharge from the wound. So by this lab culture test as well as the urine culture test and stool culture test they will be identify what is the main root cause of the diseases. Now come to the radiologist. So the people which specializing in the interpreting the medical image such as X-ray, MRI, CT scan to diagnose and treat the illness or injury. Now come to the pharmacist. So professional who prepares and then disappears the medication, monitor and evaluate the actions of the medication on the patient. Now come to the psychologist who is mainly assess and treats the emotional behavior and cognitive issues through the therapy and counseling. So healthcare team is also one of the the most important question for 2 marks or the 5 marks. If they're asking you in the 2 marks, just you point out what are the persons should be present in one healthcare team. If it is in 5 marks, you have to give little bit brief explanation for each and every person's role. Okay, so now come to the nursing as a profession, and that is also one of the most important questions as a essay question. Explain nursing as a profession. Okay, so profession, what is the profession? Profession is nothing but it is an occupation, vocation or the career which specialized knowledge of a subject, field or science is applied, and it's also going to usually apply to the occupation which involve the prolonged academic training and then formal qualification. Now come to the characteristics of the profession. So first is specialized education. Obviously nursing is a specialized individual education for the 3 years, 2 years or the 4 years like journey. Now come to the body of knowledge. Who is the body of knowledge of our nursing profession? That is INC, means Indian Nursing Council as well as the SNC or State Nursing Council. Now come to the service oriented. Obviously we are going to provide the service like physical, mental or spiritual or whatever to the patients as a healthcare worker. Now come to the ongoing research. On the nursing profession, many research are coming, and the researcher also doing more research on this particular specifically nursing process, nursing procedure as well as the research topic. Okay, so new relevantly it will come as a like new technology or new profession or the some new theories which will be much more effective for the patient care. Now come to the that is code of ethics, and last one is the autonomy. So these all are the characteristics of the profession. So from this you can ask you can get the question like what is profession and characteristics of a profession. That question also you will get. But if they're asking as a nursing as a profession, but first you have to start with the profession. What is the profession? What is the characteristic of a profession? Now come to the criteria. Why what are the criteria is present in our nursing education? So for that, nursing is considered as a profession. First is the distinct the identity and then subculture, which means the members of a profession, they have a common identity as well as a subculture. Next one is body of knowledge. So the nursing profession's body of knowledge which is generated through the research and then theory building, which is rapidly accumulating. So what is happening? New technology is coming in our profession as well as new treatment procedure, new therapist procedure is also coming. Now come to the altruism. So what do you mean by the altruism? It's nothing but it's defined as an orientation towards the services. Members of a profession, they are motivated by the altruism as well as work for the good for society. Now come to the code of ethics. So nursing has developed their own code of ethics, which is most instances has set up minds to monitor the professional behavior as well as for the members. Now come to the autonomy. Professional autonomy, it means nothing but like self-regulation, self-governing as well as a self-directing. So as a nursing student or as a nurse, we are also motivating ourselves to do this service for that particular patient, to direct that particular patient in a particular way. So these are all things we have to keep it in our mind. And this also profession as a autonomous if it is regulate itself and then sets the standard for its member. Now come to the professional organization. The American Nursing Association is a professional organization. Mainly they are advancing the nursing profession by developing the high standard of the nursing practice. Now come to the values of a nursing profession. What are the value are there as a nursing profession? For that, nursing is considered as a noble profession. First, profession which values is nothing but values acquired during the socialization into the nursing from code of ethics, nursing experiences, teachers and then peers. So what is the caring? First, promoting the health, healing and then hope response to the human conditions. Next come to the integrity. Integrity is nothing but it's respecting the dignity and then moral wholeness of every person without any kind of conditions or the limitation. Now come to the diversity, which affirming the uniqueness and then difference among the person, ideas, values as well as the ethnicities. Now come to the excellence. So from the excellence, co-creating as well as implementing the transformative strategy with a clever and then inventive thoughts, which based on the excellence, the different fields of the nurses are as like registered nurse, licensed practical nurse, travel nurse and intensive care unit nurse. So these are all the values of our nursing profession. Now come along with this particular things excellence, more than that, like emergency room nurse, home health care nurse, operative room nurse, as well as the post anesthesia care unit nurse, then dialysis nurse, as well as a neonatal intensive care unit nurse. So now come to the code of ethics and professional conduct of the nurses. So code of ethics is nothing but it's a set of the ethical principle which is accepted by all the members of our universe. So for that only we can consider the nursing as a noble profession. So what are the purpose? First is code of ethics, which is used to guide the professional behavior. In the nursing profession, the code of ethics which helps the teachers to know what must be taught in the education for the nursing students, and also it can be used to prevent a nurse from practicing in his or her conduct is poor, and it also can be used to protect a nurse who is falsely accused for doing the something wrong. Okay, so now come to the elements of code of ethics or international code of ethics. First is nurses and then people, means nurses versus society. So this primary professional responsibility is nothing but for caring the people which is requiring the nursing care, and the nurses, they hold in the confidence personal information where they are using the judgmental process in sharing this information. Now come to the nurses and then practice. So what is this? Mainly the nurse there carries the personal responsibility as well as the accountability to the person. So what is happened for that, the nursing practice, they all time maintains the standard of the personal conduct which is mainly reflect well on the profession and enhance the public communication. Now come to the nurses and then profession. So when they are on the duty, they can't share their personal information to others, as well as same way they can't disclose the personal information of the patient to the others. Okay, so that is called personal dignity as well as professional dignity, which is determining as well as implementing on the quality of care, and also they are going to develop a core of the research based professional knowledge. Now come to the nurses and then co-workers. So how they have to maintain the proper relationship with the colleague in the hospital sector. So they have to the cooperative relationship, and always as a nurse we have to keep it in mind, it is a teamwork. So as a nurse, if you know something, you can't directly and go and implement, you can't implement on the patient. Okay, first you have to discuss with your team members, then it will go to the doctors, and if they are going to allow you, then only you can able to do it. So that is called nurses and then co-workers. So what will happen, they can able to take the appropriate action for the safeguard individuals, families as well as the communities when their health is endangered by the co-worker or by the other person. So this is also one of the most important questions. As a in that question you get the two questions. First is explain the nursing as a profession, and second one is explain the code of ethics in a nursing profession. Okay, so might be they will ask you in the 5 marks questions as a individually, or if they are asking you explain the nursing as a profession in a 10 marks, you have to include all those things. Okay, and if they are asking you only code of ethics, then you have to go for it. What is the code of ethics, purpose, and mainly you have to focus on the elements of the code of ethics. Okay, so if 5 elements you have to input it. So that is the 2 more important questions in a 1 question. If they're asking nursing as a profession, in between you have to include also the code of ethics of a nurse. But other than that, if they're asking individually, then you have to write it down on a individually. So now come to the communication. This is also one of the most important question for 2, 5 or 10 marks. Mainly in the 2 marks they are asking you from the communication part, like what are the components of the communication, explain the communication, and explain the types of communication. Okay, and for the 5 marks they are asking you mainly briefly about the types of communication. Okay, and in the 10 marks they are asking you full, means explain the communication. Then you have to write definition, purpose, then what are the components, what are the ways of communication, means types of communication, everything. So let's discuss about the communication. Okay, so communication is nothing but it's a dynamic process which takes place around us all the time, and it's also a fact we spend the 70% of our time receiving as well as spending messages, and it's also exchange of the idea, fact, feelings, thoughts, opinion, and then information which is more vital in facilitating the human interaction through the written or spoken words, symbol, or the action. So now come to the definition. So communication is nothing but it's a process of the generating, exchanging, understanding, and transmitting the information in between the two individuals, and is also a process in which a message is transferred from one person to other person through a suitable media, and is also going to intend the message is received as well as understood by the receiver. How you come to know? By the feedback of the receiver. So now come to the principles. This is what are the principles? First is the appropriateness, means suitable to the situation. Clarity, communication should always be clear. So when you are going to communicate with the patient as a nurse, your communication should be clear and very transparent, and you can't use any kind of medical abbreviation or the like a hard English word which will not be understandable for the patient. Okay, you have to use very general and then common language. Now come to the channel of communication. So it's mainly we choosing carefully so that the clarity it should be maintained in the communication. So for example, Hindi speaking patient can't be instructed in English or any other language. So who know like as in between the nursing staff who is the well known of the Hindi person, so they have to speak with that particular patient. You can take a help. Now come to the feedback. It should always be sought to the prevent any doubts or the information regarding the treatment or the process which we are going to share to the patient. Now come to the levels of the communication. First is the interpersonal communication. That is also one of the most important 2 marks question. Explain the types or the levels of communication. First is interpersonal. It's also known as a self-talk. Now come to the interpersonal. So interpersonal is nothing but which include the communication between 2 or more individual, and it's also have the goal to exchange the masses. Now come to the group communication, which refers the communication which occurs in between 3 or more individuals, means in a group wise. Now come to the public, which is a large gathering. Example, the politician addressing the citizens. Now come to the organizational, which follow the message in a company or agency on an organization. Now come to the types of communication. So based on the modes of communication. Okay, so first is the verbal communication, so which is means as a spoken as well as a written word. So verbal language is nothing but it's creating as a code which conveys the specific meaning or the combined words. Now come to the types of verbal communication. First is the oral and second one is the written. So oral means which refers the communication you speaking, means 2 person individually they are speaking with each other. So that is called oral communication. So it's mainly involves as a face-to-face conversations, as well as the volume, speed and clarity of the speaking should be present. Now come to the written, which involves the use of the words by the writing. What is your thought, what you want to share, you are expressing your emotions or thoughts or whatever through by the written words to the other people. So that is called written and mainly is going to used in the organization. Now come to the non-verbal communication. So it's nothing but it's mainly involves as a wordless conversation, also referred to based on the body language. Okay, so first is the facial expression. So it's nothing but like you are expressing your emotions, your thoughts or what you want to say to that particular persons through your face, either happy face or sad face or any charming face, etc. Now come to the gesture. Gesture is nothing but movement of the body parts like hands or facial expression information, so you are going to provide. Now come to the reflex, the authority of the touch, which carries a varied meaning in the different situations. So nurses they must be aware of the choosing the touch in appropriate therapeutic manner. Now come to the gait, specific way of talking when you are happy. You have the jumpy bouncy walk when you are happy. When you are sad you can be walk silently, etc. Now come to the eye contact. When you are talking with any kind of the patient, no, you have to maintain the proper eye contact. If you not maintain, means the patient will not be able to share their information to the people, means to you. So you can't take the proper data from the patient. Now come to the posture, which reflects the attitude of the person. So if you are so busy, you are anxious, but if you are showing your anxiety to that patient, so what will happen? Patient will not be trusting you again. Okay, so they will not share their complications to you. So what will happen? Quality of care is going to be impacted. So for that, you have to maintain always posture. How much anxiety, how much like anxious you are getting, you can't show your attitude to the patient. Okay, now come to the electronic communication, which nothing but like internet or through the website you are giving some information to the others, is also known as a new modes of communication via email, social media or text, which is known as the electronic. Now come to the types like social media. So social media is nothing but sharing information. Social media like WhatsApp, Twitter, then Facebook, etc., as well as the even official information is being exchanged on this platform, as example the LinkedIn as well as Indeed. So this privacy and confidentiality of this information is an issue. So now come to the email and text. Is effective ways of the communication with an organization, but it should always be very specific as well as the concise. Now come to the based on purpose of the communication. So based on the purpose, first is the formal communication, which deals with the sharing of official information with the others who actually need it. Now come to the informal, is the spontaneous, unofficial and then casual exchange of the information between the individual with an organization or the group. Okay, so these all are about the communication. This is also one of the most important for 5, 10 and 2 marks. What kind of question will come? I already said. Now come to the beds of the patient, means beds of the hospital. So that is also one of the most important questions for the 2 marks. Explain the types of the beds. Okay, for the 2 marks, types of the bed. So first, what are the beds? Simple bed means closed bed, open bed, occupied bed. Now come to the special bed, operation bed, cardiac bed, blanket bed, amputation bed as well as a fractured bed. So if they're asking you for the 2 marks, you can write it what is the hospital and all, giving some introduction, and next you can give it means list out on this only those things, simple bed and special bed. But if they're asking about the 5 marks, then you have to giving some information. So now come to the closed bed. Otherwise they are asking you individually. Okay, explain about the closed bed, explain about the open bed, explain about the occupied bed. So you have to give it. Okay, so now come to the closed bed. Closed bed is nothing but it's an empty bed. In the top covers are so arranged that all the linens beneath is fully covered and protect from the dust and dirt. So what are the purpose? Comfortable and safe bed, give a neat appearance. Next, medical and nursing treatment, prevent the bed sore for the patient and promote the cleanliness as well as effective the nurse-patient relationship. Now come to the open bed. So what do you mean by the open bed? This term used when the hospital bed is to be occupied by a client. Okay, so the purpose is nothing but to provide the beds, to prevent the bed sores, to utilize the time, material and then effort to help the relatives to learn to take care of the sick at home, to give a neat appearance to the ward, to provide a comfort and then security or safety, to provide rest and sleep for the patient and to establish effective the nurse-patient relationship. So now come to the occupied bed. Occupied bed is nothing but the patient will be present on the bed and it's also known as a simple closed bed. Okay, so what are the purpose? To give a clean, comfortable bed to the patient, to provide a clean and neat appearance for the ward, to prevent the rest and sleep for the patient and to must be safe for the patient, and it must be economize the time, effort and materials for the nurses. Now come to the post-operative bed. It's a very specialized bed after the operation and take care of the patient returning for the surgery. So what are the purpose? To receive the post-operative client for the surgery and transfer him or her from a stretcher to the bed, as well as to arrange the client's convenience and safety. Now come to the cardiac bed. Cardiac bed is mainly used for the patient who is having fracture as well as the cardiac surgery or anything. Okay, so it's a type of the bed which mainly arranged to keep the patient in sitting position with the pillow as well as with the cardiac table. So what will happen? It relieves the patients from the problems caused by the heart disease. Now come to the purpose, to provide the cardiac position like settle position as well as to make the patient as comfortable as possible when sitting upright, and to relieve the dyspnea caused by the cardiac disease and to prevent the complication used by cardiac diseases. Now come to the blanket bed. It's prepared for the patient with the renal disease or the rheumatism. Rheumatism is nothing but inflammation and pain of the joints. So what are the purpose? To promote the eliminations through the skin, to prevent the absorption of the patient's perspiration, and to carry the weight of the bed cloths of the painful joint, and to provide the extra warmth of the bed. Now come to the amputation. Amputation is nothing but like removing one part of body part. Okay, so amputation bed, they're mainly prepared for the patient with amputation of the leg to take off the weight of the bed cloth of sheet of the operation. So what are the purpose? To keep the limbs in a good position, to be able to watch the limbs for the hemorrhage and apply the tourniquet instantly if it is necessary, to allow the nurse for the separations procedures such as bladder irrigation without any exposing the patient body part, and to allow the nurse to make the frequent observation. Okay, so these all are about the types of bed and their explanation. Now come to the linen and then equipments. Okay, so from this linen and equipment, this is also some important question, that is care of the linen. How you have to take care about the linen. First we have to know what are the linens. Present you can see in the hospital. First is bed sheet, pillow cover, blanket, towel, patient gown, surgical gown, curtain, aprons, doormats, as well as hot water bag covers, right? So as a nurse, what is our role? Means how we have to take care it. The linen cupboard should be kept in perfect order. The cupboard should be locked when not in use. Care should be taken to avoid the linen being taken home by the patients. Stock should be checked at the regular intervals, and all time should be used for the purpose for which they were made, and soiled linen should not be placed on the floor. Torn linen should not be placed on the bed, and damp linen should be dry immediately. If soiled with the urine or motion, then we have to rinse with the cold water. Remove the stain where staining is unavoidable. The infected linen should be disinfected fast, and then Macintosh wherever it is necessary to economize the use of the linen. Now come to the care of rubber goods. What are the rubber goods we are using in the hospital? That is rubber Macintosh, air cushion, hot water bottles, ice cap, rubber tubes, catheter gloves, as well as the rubber beds or the air beds or air mattress. So what should be the steps to take care? It is the disappear where the water of the gloves should wash them on their hands just before they are removed to prevent adherence of the blood. After removing from the hat, they have to wash with the soap and cold water first on the outside, then intervert and repeat on the inside. Then they have to rinse well with the water both inside and outside of the holes, and then the tears which is discovered by the submerging the glove filled with the air in the water. Then they have to separate the torn gloves, hang them to dry. When outside is dry, turn inside out and then dry. Then they have to both sides are dry, powdered inside and outside, then packed in a pairs in the same size, and right and left gloves in a pair. And they have to steam under the pressure in the best method of the sterilizing gloves. The pressure should be kept minimized to avoid the melting. Okay, so these are the steps to care of the rubber goods. Mainly this is questions they are asking for the 2 marks. Okay, explain the care of the good linens or the rubber goods. Now come to the care of glasswares. Glassware in the sense like a specs and all. Okay, so what are the handling? How you have to handle? You have to handle the glassware with a clean dry hands to prevent the contamination and reduce the risk of breakage, as well as you have to wear the appropriate personal protective equipment such as gloves or safety goggles. Now come to the cleaning. So you have to rinse the glass water with the water immediately after use to prevent the residues from the drying and sticking on the glasses. Use the mild detergent for the cleaning and rinse the thoroughly with distilled or deionized water to remove all the detergent residues. Now come to the drying. So you have to use a clean dry track or the soft cloth to allow the glassware to air dry. So storage means you have to store the glassware properly in a clean and dry environment to prevent the contamination and the damage. Regularly, you have to do the inspection for the glassware. You have to check the signs of damage, including cracks, chips, or the scratches. Now, temperature, you have to check. Be mindful for the temperature changes, rapid temperature variation, which might be cause the glass to crack or shatter. Now, come to the education. You have to train the individuals who will be handling the glassware, especially in the laboratory, or the proper techniques for the safe handling and care. So, now come to the vital signs. That is also one of the most important topic for your exam. So vital signs is nothing but it's a reflect essential body functions, include your heartbeat, breathing rate, respiration rate, pulse rate, etc. and the blood pressure. So what are the principles? It should be governed by the vital organs, often revealed to the slight deviation from the normal range. The changes in the conditions of the patient, improvement or registration which might be detected by the observation of the signs, and then significant variation in this finding which may indicate the problem regarding the insufficient consumption, as well as the vital sign specific information which be obtained that will help to diagnose treatment and medication or the nursing care. So now come to the timings to taking the vitals. First, on the patient's admission site in the hospital on the routine schedule site, then during the patient visit to clinic, before and after any surgical procedure, before and after any invasive diagnostic procedure, before and after any kind of the medication administration, especially the cardiovascular and respiratory, and in any kind of emergency situation. So first come to the temperature. So body temperature, which is the measurement of the heat inside of our body. So how we were going to like temperature regulations of the human body? First is hypothalamus, center of the temperature regulation, then anterior hypothalamus for the heat loss and posterior for the heat production. So what are the factors which is influencing the body temperature? Age, stress, exercise, hormones, environment, as well as the diurnal variation. Now come to the assessment. How you are going to assess the body temperature? What are the sites you are going to use for the body temperature? Tympanic membrane, then axilla. Now come to the oral and then rectal. So mainly these four sites we are going to use to check the body temperature. So through the thermometer we are checking, right? So thermometer, which is instrument used to measure the body temperature. Three main types of the thermometer is there. That is mercury thermometer, digital thermometer, and then infrared thermometer or the tympanic thermometer. What are the parts of thermometer? First is the stem, expansion chamber, scale linen, capillary tube, column of the mercury, construction, prevent black flow of the mercury, and then mercury bulk. Okay, so these are the main parts of the glass thermometer. So what are the temperature conversion formula? Means degree Celsius to Fahrenheit and Fahrenheit to degree Celsius. So first Fahrenheit to Celsius. Okay, so degree Celsius means degree Fahrenheit minus 32, and that number should be multiplied by the 5 by 9. Okay, so see, convert 35 degree Fahrenheit to Celsius. So solution is coming degree Celsius is equal to 350 minus 32 into 5 by 9. So is coming 176.6 degrees Celsius. So same from the Fahrenheit to the Fahrenheit to the Celsius means the degree Fahrenheit is equal to degree Celsius into 9 by 5 plus 32. So for example, let us convert the 20 degree Celsius to the Fahrenheit. So degree Fahrenheit is equal to 20 degree into 9 by 5 plus 32 is equal to coming as a 68 degree Fahrenheit. So this is the formula you have to like remember it. Okay, now come to the blood pressure. So blood pressure, it's a force of the blood pushing against the artery walls. Okay, so we have to see the characteristic. First is the component, definition, features, and the normal value. Come to the systolic blood pressure. So what is this? Is the maximum pressure which is exerted during the systole. So what are the pitches? Undergo the considerable fluctuation. So range is 100 to 140 and average is 120. Okay, diastolic or the DBP, it's a minimum pressure which is exerted during the diastole, undergoes much less the fluctuations and range is 70 to 90, average is 80. Then pulse or pulse pressure or the PP, it's a difference between the SBP and then the DBP. Okay, so it's mainly determine the pulse volume, average is 40, and the mean blood pressure or the MBP, it's average pressure throughout the cardiac cycle. So MBP is equal to DBP plus 1 by 3 pp. Okay, so range is around 95 minus 95 to 100. Okay, so these all are the normal values. So from these the questions like blood pressure, you can get the fill in the blanks. What is the range of systolic blood pressure? What is the range of pulse rate or diastolic blood pressure, etc. As well as like essay questions you are getting or 2 marks questions. Now come to the assessment of the blood pressure. So monitoring blood pressure using the palpation or the sphygmomanometer. So what is the purpose? To obtain the baseline data and to assist in evaluating the status of the patient blood volume, cardiac output, and then vascular system. What are the procedure? First we have to wash our hands. We have to gather all the necessary equipments, check the client's identification and assist in the client in comfortable position. Then we have to check the brachial artery and wrap the cuff. Then we have to measure the blood pressure measured by the two methods, palpation and auscultation. Then again we have to go for the hand wash and record the procedure. So what are the equipments is needed? Actually digital sphygmomanometer, mercury sphygmomanometer, and then manual sphygmomanometer. So during the emergency situation, you just remind either mercury or the manual sphygmomanometer only is going to be used along with the digital thermometer. So now come to the alteration, that is hypertension and hypotension. Hypertension means increased blood pressure, hypotension means decreased blood pressure. Now come to the fever or pyrexia. That is also one of the most important questions for 5 or 2 marks questions. So fever or pyrexia is nothing but it's a increasing the body temperature about the 37.2 degrees Celsius. So fever is not a disease but it's a sign. Fever is a protective function of our body because the raising of the temperature which prevents the growth of organism that cause the disease. So what is the definition? Fever or pyrexia is defined as a rising in the body temperature above 37.2 degrees Celsius or 99.6 degree Fahrenheit. So what are the causes? Infection, disease of any kind of nervous system, certain malignant like neoplasm, blood disease such as leukemia, embolism or the thrombosis, heart stroke, dehydration, surgical trauma, or the skin abnormalities or any kind of allergic reaction. So types, what are the types? Hypothermia means increasing, hypothermia decrease the body temperature, rigor, lower pyrexia, moderate pyrexia, high pyrexia, constant fever, remittent fever, as well as the intermittent fever. So these all are the types of the fever or pyrexia. Now come to the hot and cold application. So hot application is nothing but like hot water bottle, warm soak, local bath, electric heating pad, heating lamps, sun bath, as well as the steam bath. So cold application like ice bag, ice cooler, ice pack, cold compress, and then cold bath. So what are the therapeutic causes of the hot and cold application? So mainly heat decrease the pain and muscle tone, it's promote the healing, provide warmth, stimulate the peristalsis, as well as relieve the deep supervision. And cold, they are helping to relieve the pain, prevent gangrene, prevent the edema, and reduce inflammation, control the hemorrhage, and reduce the body temperature. So now come to the record and reporting. This is also one of the most important part of a nursing process. Okay, record and reporting. So what we can do and we can't do: don't copy information, don't use the vague term, and don't use the PUTS in place of the patient signature. Okay, and do the proper medical necessity, do be specific, do be truthful, and do the document and treatment result. So legal guidelines, what are the legal guidelines we have to follow? Mark the enters time and data. We have to enter the healthcare provider's name and role. We have to enter immediately after providing the care. Always remain the legible, objective, as well as the accurate. Keep a professional tone while writing the document. You should only use the standardized abbreviation. Make use the corrected with a single strike hold, and can't do forget to date the corrections. Okay. Minimize the legal issues by affecting the record keeping. What are the things we have to maintain? Keep the records under safe custody of the nurse. No individual should be separated. Maintain the confidentiality of the information. Strangers are not permitted to read the records. Records are not handed over to the legal advisor without written permission of the administration. Do not scribble out the charting, and do not alter the charting. It is a legal document, and send the document to the medical record department or the MRD for the further uses. Now come to the reporting. So reporting is nothing but oral report, written report, or the computer based communication which is meant to convey the information. So reporting type like oral, written, then changes the sheet after reports or the 24 hours report. 24 hours means what are the things we have to do for the each and every nurses that report have to send. Now come to the transfer in or transfer out report. Then incident report like emergency situation or the patient is want to discharge as a LAMA or DAMA, everything. Then birth and death report as well as an anecdotal report. Okay, so up to this I discussed about the nursing foundation 1. I hope you all understood what and all important topic, what and all questions might be coming from this nursing foundation 1. Okay, so now I am going to insight into the nursing foundation 2. Okay, so from the Nursing Foundation 2, this is most important questions, means topic from the Nursing Foundation 2 introduction part. Okay, that is health assessment. So what do you mean by the health assessment? Is a systematic, deliberative and then interactive process from where the nurses use the critical thinking process for the collection, validating, analyzing and then synthesize the collected informations, which is mainly help to order make the judgment about the health status and then the life process of individual, family and then community. Okay, so what are the purpose which is mainly affecting the health assessment? Gather the information regarding client's health, to determine the client's normal function, to organize the collect information from the patient, to frame the nursing diagnosis, to contribute the medical research. So what are the factors that's affecting the health assessment? First is physical settings of the hospital, client's personality and then behavior, communication skill, nurses personality and then behavior, nurses knowledge and the skills. Okay, so now come to the principles of the health assessment. This is an accurately and timely we have to do the health assessment, which is provide the foundations of nursing care and then intervention. And then health assessment process, which include the data collection, documentation and then evaluation of the client's health status and response for the health problems and intervention. All the documents should be objective, accurate, clear, concise and specific as well as a current basis. Health assessment, it is in practice in all the healthcare settings whenever there is a nurse client interaction, and then client confidentiality should be kept. Okay, so under the health assessment there are so many parts are there, like history collection, physical examination, etc. Okay, so now we are going to discuss about the history collection. So while you are going to write the care plan, what should be the format? So that is format is theoretically from the health assessment part. Okay, so that is the health history. So history collection, it's a structured interview part where you are collecting the specific data of the patients regarding physical, mental, gynecological, social as well as the spiritual and then family history. Okay, so as well as past and present medical history. So format of the health history. First come to the biographical data, next come to the chief complaints, present and past medical history, present and past surgical history, family history, socio-economic history, obstetrical history, female clients. For the female clients only it is applicable. Next is the mental health history. Okay, so these are the formats we have to remember. So first come to the biographical data. So under this age, gender, qualification, education, occupation, sex, marital status, religion, family history, ward name and then bed number, means IPOP number, then diagnosis as well as the address. Now come to the chief complaints. So chief complaints is nothing but what are the conditions, mean what are the complaints that happening, why they came to the hospital. So how we have to write in our file, like chief complaints, the patient name is XXS, came from came into our hospital with the chief complaints of like vomiting, nausea, headache, etc, etc. Okay, so see, chief complaint is nothing but it's a brief statement of the client's problem or the client's complaint. Past 2 days I have cough, fever and then headache. Now come to the present and past medical history. So present medical history and past medical history is nothing but they mainly help to elaborate the conditions, why the patient is getting, whether it was present previously, again it's reversing, or patient is freshly for this particular disease conditions, and it's also help to previous or present issues, treatment and anesthetic or the prognosis. Now come to the past and present surgical history, which is mainly about the types of anesthetic, prognosis, surgical like surgery procedure, what is happened, what on the parts surgeries happen, everything. Okay, now come to the family history, whether the disease is coming as a like heredity basis or the patient is getting for the chromosomal basis, everything will come to know from the family history. So health information of the family is very important for the blood relatives, any heart disease, endocrine disorder, seizure, tuberculosis, etc. So now come to the family tree, that is male and that is female. Okay, so in this like circle is indicate as a female and then box is indicate as a male, and if it is female patient, so if it is female patient, so under the circle we have to scratch it, so that is mean female patient, and in the box if it is scratch is mean like male patient. Okay, so that is the family tree, 3 generation we have to put in the family tree. Now come to the socio-economic history. So socio-economic history is nothing but mainly based on the religion, marital status, occupation, lifestyle, family income, and these all the information which help to find out the risk factor and then disease producing factor. Now come to the obstetrical history for the female female client, what is happened, we have to check about the menstrual history, history of pregnancy, labor information like normal or LSCS, and if any other complication like abortion, then PCOD or stillbirth or live birth, everything if it is, we have to check. Now come to the mental health history. So mainly it's collect the information about the client's awareness and its behavior by the family members. So history collection is done under the physical assessment. Now come to the physical examination. So under this physical examination, mainly some parts are there, that is inspection, auscultation, percussion, and palpation. Okay, so these four parts we have to know. So physical examination is head to foot assessment to evaluate the body as well as function. So what is the purpose? Mainly gather the baseline data about the client's health, to confirm the identity and the nursing diagnosis, to make the clinical judgment about the client's changing health status and management, to evaluate the physiological outcome of the care. Next, to identify the health problem. It is used for the medical research, and it makes also the good interpersonal relationship with the patient and determine the nature of the treatment. So what are the principles of the physical examination? Maintain privacy, make sure the good lighting is available, maintain the proper position like supine position. We have to inspect each area of the size, shape, then color, symmetry, position as well as any abnormalities, and do not hurry the inspection. The room should the warm and clean, comfortable examination table. So now come to the methods. First come to the inspection, means visual examinations of the body is called the inspection. So this observation in the naked eye which determine the structure and then functions of the body. So assessment through the inspection like rest and then activity needs, nutrition, fluid and electrolyte needs, safety and then security for the patient, hygiene as well as a grooming, oxygenation and then circulation needs, psychosocial needs as well as a elimination. So in this the types of inspection like general inspection and then local inspection. General inspection means all over the body, and local inspection means particularly any part of the body. Okay, so that is all about inspection. Now come to the palpation. So palpation is nothing but it's a feeling of the body part with the hands to note the size and position of the organs. So obtain the information by using the hands and fingers to palpate. First is the light palpation and deep palpation. Light palpation means based on the subcutaneous layer we have to do, and deep palpation means we have to press over there and we have to assess the position and then shape a size. Now come to the percussion. So percussion is nothing but examination by tapping with the fingers on the body to determine the conditions of the internal organs by sounds which are going to produced. Areas, which are the areas we are using for the percussion? Lungs, bone masses, viscera, liver or the stomach, gas in the intestine, air trapped in the lungs, as example the emphysema. Now come to the types of percussion, that is immediate percussion means suddenly we have to do it, means directly. Now come to the mediate, with some media like through after placing over the any kind of sheet and all everything. And now come to the fist percussion. Fist percussion in the sense like we have to indirectly we have to place this non-dominant hand two fingers inside of this, and after that we have to tapping over there and again we have to assess it. So that is called fist percussion. Okay, now come to the auscultation. So auscultation is nothing but it's a listening to the sounds with the body with the aid of stethoscope, fetoscope, etc. So what are the types? That is direct auscultation and indirect. Direct means by directly you can hear the sound through your ear, and indirect means either by using the stethoscope or the fetoscope we are hearing. Okay, so that is called the auscultations. Okay, so if they're asking about the health assessment explained, so that time you have to give the history collection as well as physical examination. But sometimes frequently they're asking mainly about the physical examination. Okay, so in this physical examination you have to give this 4 steps: inspection, palpation, percussion and auscultation. This is the stepwise. Okay, so if they're asking for any kind of the particular individual body part, so for each and every body part the physical examination steps are same, but for the stomach the physical examination steps are different. First inspection, now come to the auscultation, then percussion, then palpation. Okay, just mind it. When they're asking about the stomach, you have to give this answer. If they're asking about generally, then you have to give the stepwise answer. Okay, so this is most important for your viva, for your essay questions, for your any kind of 2 marks questions. Okay, so now come to the offlection. This is one of the most newly implemented, like what I should say, newly implemented one process of the physical examination, that is olfaction. Olfaction is nothing but assessment the sense of the smell. So it's a well developed sense of the smell which enables the nerves to detect the odors which is characteristics of the certain conditions. Some alterations you can see in the body functions, and then some bacteria which is create the characteristics of the odor. For example, fishy smell to infected urine, ammonia odor associated concentrated or decompressed urine, musty or offensive odor for the infected wound. Now come to the assessment of each body system or head to foot examination or head to toe examination. This is the example of the physical examination. Okay, so come to the general appearance. First is nourishment. Well nourished or undernourished, body built, thin or obese, we have to see. Then health, healthy or unhealthy, activity, active or dull. Mental status, conscious, like either conscious, subconscious or delirious. Then look anxious or worried or depressed. Under the posture, we have to check the body curves, lordosis, kyphosis or scoliosis if it is present or not. Movement, any lip like abduction, reduction is present or not. Now come to the skin condition. For the color like pale or jaundice, cyanosis, flushing, etc. it is there or not. Texture means dryness, flaking, wrinkling or excessive moisture if it is present on the skin or not. Temperature like warm, cold or clammy. Lesions means macules, papules, vesicles, wounds, etc. Head and face like shape of the skull and fontanelle. Skull circumference. Scalp means cleanliness, conditions of the hair and dandruff we have to see. Face means pale, flushed, puffiness, fatigue, pain and then feel anxiety. Now come to the ears. For the external ear like discharge like cerumen obstructing the ear passage. Tympanic membrane like perforation, lesion as well as a bulging. Hearing means hearing activity. So under the eyes, eyebrow we have to check whether it is symmetry or unsymmetry, means normal or absent. Eyelashes infected or stye. Eyelids means edema, lesion it is present or not. Eyeball means shrunken or protruded or not. Conjunctiva pale, red and purulent or not. Sclera means jaundice is present or not. Cornea and iris we have to check the irregularity and then aberrations. For the pupil we have to check the dilated, constricted or reactions to the light or not. For the lens we have to check the opaque and then transparent, and for the fundus we have to check the concession and then hemorrhagic spot, and for the vision we have to check the normal or hypnea. Now come to the nose. For the external nose we have to check discharge or crust. For the nostril we have to check the inflammations of the mucous membrane, septal deviations. Mouth and pharynx. For the lips we have to check the redness, swelling, crust, cyanosis or any irregular stomatitis. Odor of the mouth, foul smelling. Then teeth discoloration or dental caries we have to check. For the mucous membrane and gums we have to check the ulcerations or bleeding, swelling or pus formation. For the tongue we have to check the pale, dry, lesion, sores as well as the furrows. For the throat and pharynx we have to enlarge the tonsils, redness and pulse. For the neck, lymph node we have to check whether it's enlarged or palpable. Thyroid gland we have to check whether it's enlarged or not. Range of motion we have to check the flexion, extension and rotation. For the chest we have to check the thorax like shape, symmetry of expansion as well as posture. Breathing sound we have to check the size, twitch, rustle and wheezing. Heart for the size and location. Cardiac murmurs. For the breast we have to check enlarged the lymph node present or not. For the abdomen we have to observe the skin rashes, scare or hernia. Auscultation we have to do the like hernia bowel sound as well as fetal heart sound. For the palpation we have to do the liver merging, palpable spleen and then inguinal hernia. And percussion we have to check the presence of gas, fluid or masses. And for the extremities we have to check movement of the joint, tremors, clapping of fingers, ankle edema as well as varicose vein, reflexes. And for the back we have to check the spina bifida curve. Okay, so now come to the last, that is genital and rectum. So inguinal lymph node enlarged or palpable. Then patency of the urinary matters on rectum in infant, descent of the testes, vaginal discharge and the presence of sexually transmitted disease, hemorrhoids we have to check. And also we have to check the enlargement of the prostate gland, pelvic massage. So now come to the critical thinking. This is also one of the most important questions for the 5 marks. So till now I discussed about the 10 marks question, that is health assessment under this physical examination as well as a health history collection, and under this head to foot assessment. So now come to the critical thinking. Critical Critical thinking is nothing but it's a self-directed and then disciplined cognitive thinking, which is process of analyzing and then evaluating the information or the situations in a very systematic as well as a reasonable way, which involves the actively questioning assumptions and considering the different perspective and making all the informed decisions. So it's a very native process which aims to achieve the high quality of the reasoning. So what are the characteristics? First, it should be the analytical, open-mindedness, creative, curious, inference, communication, comprehension, then objectivity, problem solving, awareness, questioning and observing, as well as the active listening. So what are the process? First is the identify. As a nurse, we have to identify the first and important step of the critical thinking, where the person understands the importance of a problem and recognize the factor as a influencing. And also it is the ability to assume to be predict easiest and appropriate ways for the problem and then solution. Now come to the appraisal. For this, we in the critical thinking, the appraisal phase usually involving the evaluating and assessing the informations or the arguments, which is mainly determine their quality, relevance and credibility. So this phase is very crucial for making the well-formed and then reasonable decision. Now come to the phase 3, that is problem solving. So under this we have to critical component of critical thinking, and it's also typically involves the several phases. So critical thinkers mainly they thoroughly analyze the problems to gain a deep understanding of the underlying causes, components as well as the complexities. So what is happened? This involves the breaking down of their concept problem into the smaller and then more manageable part and examining the relationship between them. Okay. Next part is the evaluation. So they have to assess the credibility and then reliability of the information gathered, and they also understand the context in which the information or argument is going to be presented, and it can impact their validity and personal or the reassess assumption. Now come to the analysis. In the analysis phase is a critical thinking is a crucial step where the process of evaluating and understanding the information or situation. So what will happen? It mainly involves the breaking down the information, which is examine their components, evaluating the evidence as well as the reasoning presented. So the goal of the analysis is phase 2, clear and then comprehensive understanding as a subject matter, and to identify then understand the assumption, biases as well as the logical flaws. So now come to the benefits of the critical thinking in our nursing profession. It's mainly improve the patient outcome, make the more accurate diagnosis, effective problem solving, nurses and address the complex issues efficiently, then enhance the clinical judgment, increase the patient safely, better the communication skill, adaptability to the change, in efficient the time management, continuous professional development, increase the confidence and then collaborative teamwork. So now come to the types of the urine elimination technique. This is also one of the most important, that is urine elimination. So what are the types? Urine elimination, it mainly refers the process of the explaining urine from the body. Okay, so what are the types? Voluntary voiding, involuntary, intermittent catheterization, intervening catheterization, suprapubic catheterization, bladder training, voiding on the common, time voiding, double voiding and assisted voiding. Okay, so what are the equipments we needed for the urine elimination? Toilet or commode, beside commode, urinals, bedpan, catheter, black gloves, wipes or cleansing product, diaper or the absorbent pads, toileting aids or measuring contents or bed then underpad, sailwell or the alarm system. Okay, so what are the procedure? First, for the voluntary voiding, what we have to do? We have to provide a suitable environment, we have to ensure easy access to the toilet or commode, promote a regular schedule, stay hydrated, encourage relaxation, provide assistance if they are needed. For the involuntary, means urinary incontinence patient, we have to absorbent the products. They implement the bladder training and pelvic floor exercise like Kegel exercise, which is mainly assessed with the hygiene. Now for the catheterization, we have to maintain the sterility, position the individual inside the catheter, secure catheter and bag and monitor the output. For the individual with limited mobility, we have to assist with the positioning, implement the time voiding, promote hygiene general tips and then educate on the communicate. Use of the bedpan. So bedpan is nothing but it's a container which is mainly used for the individual who are unable to get down from the bed as well as to unable to go to the bathroom. And there are also several types of the bedpan are there, including urinal bedpan as well as the standard bedpan and fracture bedpan. So with the some consideration is there when we are going to use some bedpan. Okay, urinal, standard and then fracture. So special consideration like patient dignity, proper positioning, communication, hygiene, support and assistance from the editing as well as the cleaning and documenting. So now come to the urinary drainage.
So urinary drainage is nothing but first is the condom drainage. It is nothing but it's a condom type of the catheter, which is a medical device designed for a man who experiences urinary incontinence. Okay, it's also known as the external catheter or the Texas catheter. You just remind external catheter or Texas catheter are like the traditional internal catheter which are going to insert it into the bladder. So a condom catheter is an external device which fits over the penis. So material is nothing but it consists of the sheet similar to a condom which rolls over the penis, and the sheet is connected to a tube which leads to the drainage bag. So what are the types? Condom catheter comes in a various size and shape to ensure a proper fit. So there are also different types of the adhesive as well as a non-adhesive catheter, which is depending on the individual preference and the skin sensitivity. So what are the use? It's mainly used for the managing the urinary incontinence for the main patient, which is caused by the prostate issues, nerve damage or the surgery, and it's also rolled onto the penis and secured in place. The tube which is attached to the sheet is then connected to the drainage bag, typically on the leg. So what is the intermittent catheterization? So intermittent catheterization is a medical procedure which is mainly used to empty the bladder for the individual who are unable to do so on their own, and this method also going to involve inserting a catheter into the urethra for draining the urine and then removing once the bladder is empty. So there are various types of there, that is straight catheter, closed tube catheter, hydrophilic catheter, closed system, and then pocket catheter. So what are the use? Mainly the sterility, proper hygiene and sterility we have to use. What are the techniques we have to mention? We have to record the proper technique which individuals should be trained by the healthcare professions initially, and lubricating the catheter tip, and which is held to erase the insertion, and disposable after use. We have to dispose the catheter properly. Some catheter designed for the single use should not be reused. Now come to the indwelling catheter. So indwelling catheter is also known as a Foley's catheter. It's a medical device which is designed to remain inside in the bladder for an external period, and this internal catheter is connected to a drainage bag to collect the urine continuously. So what is the design? Balloon type structure. So indwelling catheter have an inflatable balloon near the tip that is filled with the sterile water once the catheter is already placed inside of the bladder. So the bladder is helps to engulf the catheter in place and prevent it slipping out. Insertion. During the insertion into the bladder through the urethra, or in some cases through a suprapubic incision in the lower abdomen. So use cases like post-surgery, after certain surgery, as example pelvic surgery or any kind of cesarean section, etc., which helps to assist with the urine drainage during the recovery period. And in a medical condition, in the medical condition, it might be causes of the urinary retention, neurogenic bladder dysfunction, or other conditions where the normal flow of the urine is going to be compromised. So drainage system, this catheter is connected to the drainage bag which collects mainly the urine. So what are the care and maintenance? We have to do the regular cleaning, balloon maintenance, potential complication as example infection, bladder spasm and blockages. So duration is nothing but temporary of the long term. Okay. So indwelling catheter which can be used temporarily using the recovery from surgery to the illness, or they may be required on a long-term basis for the chronic conditions. And it's also essential for the individual indwelling catheter to receive the proper education on the care and maintenance. So now come to the urinary drainage. So what is this? It's refer the process of the removing urine from the bladder and collecting in the external receptacle. Okay. So in this, what are the situations during which situations we have to do? That is intermittent catheterization, indwelling catheter, suprapubic catheter, external collection device, urostomy. Urostomy is nothing but when bladder is removed or non-functional and it's created as an opening on the stoma in the abdominal wall, which is mainly redirecting the urine into the external pouch as well as urinary drainage bag. Now come to the bladder irrigation. So what do we mean by the bladder irrigation? It's nothing but it's a medical procedure which instilling a solution into the bladder to flush out or cleanse its contents. Nothing but it's a commonly used for the various medical settings or manage the specific conditions to prevent any kind of the complication. As example, clearing the clots or debris, preventing the catheter blockage. So what are the components? First is the irrigation solution. So normal saline is commonly used as a irrigation solution, but other solution are also going to use based on the physician order. And the irrigation set, which includes the tubing and container of a irrigation solution, and this tubing is going to connect it to the catheter or a irrigation spot. So types of the bladder irrigation, that is continuous bladder irrigation, which solution is continuously infused into the bladder and drained out. And intermittent bladder irrigation is nothing but when irrigation is performed intervals rather than continuously. So what are the catheter types is going to use for this bladder irrigation? 3-way catheter and 2-way catheter. So 3-way catheter is nothing but it's often used for the continuous bladder irrigation. 3-way catheter, they have a separate lumens for inflating the balloon's drainage urine and instilling the irrigation solution. And 2-way catheter is mainly the intermittent bladder irrigation, which is commonly used for the routine catheterization. So what are the procedures? Sterile technique, catheter connection, monitoring, and other complications like infection and overhydration. Okay. So now come to the diagnostic test. So from this part, mainly urinary drainage, urinary irrigation, and then catheterization. These are the most important questions for 5 marks or 2 marks. Now come to the diagnosis. So for the diagnosis, mainly you will get the 2 marks question, max to max. Okay. So in this diagnostic test, like various imaging studies, body like bladder and urine test, you are going to connect it. Means we are going to see what is the main root of cause. So this category is in the 3 phases: pre-test, intra-test, and then post-test. Okay. So first we are seeing the categories of the diagnostic test, that is laboratory test, blood test, genetic test, biopsy, imaging like X-ray, computer CT scan, then MRI or ultrasound, functional tests like electrocardiogram, pulmonary function test, stress test, then diagnostic procedure like endoscopy, colonoscopy, angiography, molecular or the immunoglobular test, which is like polymerase chain reaction, enzyme immunosorbent assay, as well as the Western blot, and then neurological tests like EEG, lumbar puncture, and then radiological test, which is like bone scan as well as a mammography. So now I am going to diving into the complete blood count test. So complete blood count test, which provide the valuable information about the composition and health of the blood. So mainly they are going to measure the blood components. So based on that, the hemoglobin level is also going to verify. So see the range. This range will come in the 2 marks questions or in the fill in the blanks. Okay. This is the most important range. For every patient we have to see when you are writing the file or the case presentation or care plan or case study, whatever, wherever you go, this range, it should be mind in your mind. Okay. So see this added normal range. So hemoglobin for the male 135 to 180 and for the female 115 to 160. For the WBC into 10 to the power 9 per liter. So for the male 4.00 to 11 means 4 lakh to 11 lakh, and for the female 4 lakh to 11 lakh. For the platelets like 150 to 400 into 10 to the power 9 per liter and 150 to 400 for the female also. For the HCV like 78 to 100 and for the female also 78 to 100. PCV for the male 0.50 to 0.52 and for the female 0.37 to 0.47. For the RBC into 10 to the power 12 per liter, that is for male 1.5 to 6.5 and for the female 3.8 to 5.8. For the MCH, that is PG, for the male 27.0 to 32.0 and for the female 27 to 32. Then MCAC gram per liter for the male 310 to 370 and for the female 310 to 370. RTW for the male 11.5 to 15.0 and for the female 11.5 to 15. For the neutrophils 2.0 to 7.5 for the male and for the female also same. For the lymphocyte 1.0 to 4.5 for both male and female. For the monocyte 0.02 to 0.8 for both male and female. For the eosinophil for the male 0.04 to 0.40 and female also same. For the basophils less than 0.1 for male and less than 0.1 for female. Now come to the variation in components used. See the RBC If it is increased, is called as a polycythemia. If it is decreased, is called as an anemia. Hemoglobin. If it is increased, polycythemia, decreased anemia. Hematocrit. If it is increased, called polycythemia, decreased if it is decreased, called anemia. Next, white blood cell count. If it is increased, is called leukocytosis. If it is decreased, is called leukopenia. Then platelet count, thrombocytopenia if it is increased, and thrombocythemia if it is decreased. Then means corpuscular volume, that is MCV, macrocytosis if it is increased, and then anemia if it is decreased. Mean corpuscular hemoglobin MCH if it is increased, then it's called hypochromic anemia, and if it is decreased, then it's called macrocytic anemia. Now comes the serum electrolyte test. So this condition is a vague symptom which will be a diarrhea, vomiting, confusion, weakness, etc. During that time we have to check. So examination process nothing but sample collection, sample progressing, then analytical method, quality control, result and interpretation. So what are the value for the sodium? Normal value 135 to 145 milligram per milliequivalent per liter. For the potassium 3.5 to 5 milliequivalent per liter, phosphorus 1.8 to 2.3 milliequivalent per liter, for calcium 9.9 to 11 milliequivalent per liter, for the urea 20 to 40 milliequivalent per liter, creatine 0.7 to 1.2 milliequivalent per liter, for the magnesium 1.5 to 3 milliequivalent per liter, and for the carbon dioxide 22 to 26 milliequivalent per liter, and then bicarbonate 24 to 30 milliequivalent per liter. Now come the serum electrolyte test. Okay. So this is a diagnostic blood examination. Mainly it's designed to assess the level of the distinct electrolyte present in our liquid fraction of our blood. Okay. So for the sodium, what are the components is present? First we have to see sodium, potassium, phosphorus, calcium, urea, creatinine, magnesium, carbon dioxide, bicarbonate, right? So if it is sodium increase, so that time it's called hypernatremia. Decrease means hyponatremia. Potassium, hyperkalemia, hypokalemia. Phosphorus, hyperphosphatemia, hypophosphatemia. Calcium, hypercalciumia, hypocalcemia. For the uremia, and creatinine means kidney disease, and then magnesium, hypermagnesium, and then hypomagnesia. Then CO2 means hypercapnia and hypocapnia. Bicarbonate means metabolic alkalosis, and then metabolic acidosis. So these kind of things you have to remind. Sometimes in 2 marks they are asking you what do you mean by the hypernatremia, what do you mean by the hyperkalemia. So that time you have to write it over there. Okay. So this part is mainly very much important for the short questions. Now come the liver function test or the LFT. So LFT is the blood test which provides the information about the status and the health of your liver. Okay, so bilirubin, what are the components are present in our liver enzyme test? That is bilirubin, alkaline phosphatase, then gamma glutamine transcriptase, alanine aminotransferase, aspartate aminotransferase, albumin, globulin, the total protein, hemoglobin, mean cell volume, white cell count, platelet, prothrombin time, international normalized ratio, urea, creatinine, and C-reactive protein. These are the main components which are present in the liver enzyme. So these all are the medical abbreviations. See, for the bilirubin means you can see in the diagnostic test, that is BIIALI means bilirubin. Alkaline phosphatase ALP. So say what is the normal range? That is less than 21 micromole per liter. For the alkaline phosphatase abbreviation ALP. So normal range 30 to 130 international unit per liter. For the gamma glutamine transcriptase 11 to 55 international unit per liter. Alanine aminotransferase 15 to 14 international unit per liter. For the albumin 35 to 50 gram per liter, and for the globulin 20 to 40 gram per liter. For the total protein 60 to 80, hemoglobin 135 to 185 gram per liter, and for the mean cell volume 78 to 100 AFL. Then white cell count 4 to 11 into 10 to the power 9 per liter. Platelet 140 to 400 into 10 to the power 9 per liter. Prothrombin time should be 9 to 12 seconds. Then international normalized ratio 0.9 to 1.2, urea 2.7 to 7.8 milligram per deciliter, creatinine 60 to 100 micromole per liter, and C creatinine protein less than 5 mg per liter. So what are the indications? First, diagnosis of the liver disease, monitoring liver disease, assessment of the liver health, evaluation of the jaundice, identification of the liver damage, drug-induced liver injury monitoring, screening for the liver condition, like preoperative assessment, evaluation of the alcoholic liver disease, and detection of the bile duct obstruction. Now come the lipid profile. So mainly in this we are going to check total cholesterol, high density lipoprotein, low density lipoprotein, and triglyceride. So total cholesterol range should be less than 200 mg per liter, high density healthy lipoprotein or HDL. It's also known as a good cholesterol. So for this range should be 40 to 60 mg per liter, and low density 70 to 130 mg per liter, and then triglyceride 10 to 150 mg per liter. Now come to the serum glucose test. So serum glucose blood test, which measures the amount of the glucose which is present in our blood. Okay. So there are different types of the serum glucose tests are there. Fasting blood sugar, random blood sugar, postprandial, as well as the oral glucose tolerance test, as well as the hemoglobin H1C, means HbA1c. So what are the vacuum like equipment is needed? Vacuum holder, then blood collection tubes, needle syringe, butterfly nets, as well as alcohol swab, tourniquets, gauze and bandages, like centrifuge, glucose analyzer, and calibrators, as well as a control. So what is a glucometer random blood sugar test, or the GRBS? So GRBS is a capillary blood sampling, which is method of collecting blood samples from the capillaries and typically from the fingertip, heel or elbow. So what is happening? It's commonly used for the glucose monitoring, especially for the home blood glucose testing. So finger stick or the finger prick sampling, heel stick sampling, and elbow. So equipments, mechanical enhancing device, then antiseptic wipes, then 2 into 2 sterile gauze, pair of gloves, and then specimen container. So now come to the measuring fluid intake and output. So when one patient is coming and admitted in the hospital, so first work is we have to measure how much fluid is needed to give the patient and how much output we are expecting from the patient. Okay. So fluid intake like oral intake, intravenous fluid, tube feeding, as well as parenteral nutrition. And output means urine output, then emesis or vomitus, as well as diarrhea. So we have to see the equipment, how we are going to calculate it. So see, fluid balance means fluid intake minus fluid output. Okay. So for example, a patient consumes 1500 milliliter of the fluid orally, and they are receiving 1000 ml of the IV fluid, and they are expending 800 ml of the urine and 200 ml of the emesis. So fluid balance or equation should be, as we know, fluid balance is equal to fluid intake. So fluid intake means here 1500 and here 1000. So total 2500, and then fluid minus fluid output. So 800 from urine and 200. So total 100. So fluid balance is around 1500 milliliter. Okay. So this positive fluid indicates, like balance indicates, the more fluids were consumed than expected, which is suggesting the fluid retention. If the negative fluid balance is coming, so that time we have to give the more fluid, which means they are going to losing the fluid which they are compared to like consumption. Okay. So now come to the blood transfusion or blood administration. So mainly this process of transferring the blood or blood components into the patient's circulation system, which is mainly like for the various medical conditions like preparation, patient assessment, patient identification, consent we have to take, blood product selection, pre-transfusion procedure, blood transfusion process, then monitoring documentation, post-transfusion care, and adverse reaction. Now come to the serum administration. So serum administration is nothing but serum is also one liquid component of the blood which remains the clotting factor, such as fibrinogen, which have been removed from the process during the process of blood coagulation. So it contains like electrolyte, antibody, hormones, protein, etc. And is also less common than the plasma administration and typically for the specific therapeutic purpose. So now come to the plasma. Plasma is a liquid component of the blood which contains the water, electrolyte, protein, hormones, antibiotic, clotting factors, and other solutes. So it's mainly obtained by the separating the whole blood into its cellular and then liquid components. And plasma administration is used for the volume expansion, replacement of the clotting factor, and then the administration of specific protein and then antibiotic. Now come to the fluid restriction. So fluid restriction which involves the limiting of the fluid intake for the various reasons like heart failure, kidney failure, liver disease, hypertension, or hyponatremia. How to raise the strict for the intake? Education and counseling, setting the daily limit, then monitoring documentation, encouraging the thirst management, limiting the high fluid and beverage medication adjustment, regular monitoring and follow-up, as well as a multidisciplinary approach. Now come to the enhancing fluid intake. What are the causes for the fluid intake enhanced? Dehydration. Next, illness requiring the increased fluid intake, physical activity, exercise, high ambient temperature, pregnancy, breastfeeding, medical treatment procedure, medication, and chronic medical condition. So what are the ways to enhance the fluid intake? Drinking water, fluid-rich food, electrolyte replacement, then the regular hydration break, monitor the urine output, individualized recommendation, hydration technique, education, and counseling. So now come to the roots of the medical administration, that is also one of the most important topic for your exam. Okay, so first come to the oral medication. Is defined the administering of the medication through the orally, which ensure the patients swallow the medicine. Now come to the purpose, cure the disease, to promote the health, to give the palliative treatment. So what are the advantages? Safe and confident, effective method, no complication of the pains, allergic reaction is very less. So what are the disadvantages? Difficulty swelling, partially observed, may irritate the gastric mucosa, vomiting or diarrhea. Now come to the intramuscular injection. So intramuscular or the IM injection, it's also an introducing of the medicine into the muscle of the solution. So what are the purpose? Obtain a quick effect of the obtained medicine, which assure the total dose will be administered, and alterations of the medicine which not suitable for the IV administration. So what are the principles? Anatomy and physiology of the body is essential for the safe administration. Insertion should be done carefully, provide the safe and comfortable environment. Antidote should be kept ready. So what are the sites? Dorsal gluteal, vastus lateralis, ventrogluteal, and the deltoid muscle. So method. First is the airlock method. So under this airlock, like draw of the medicine. So when we are drawing of the medicine from the ampule, so what we have to do? We have to leave a small amount of the space at the top of the syringe. So that is called draw of medicine. Now come to remove the air from the syringe. How you have to remove? We have to hold the syringe with the needle pointing upward, and gently we have to tap on the upside part of the needle. So what will happen? If any air bubble is there, it will be passing through the needle. So that is called removed airway. Now come to the create an airway. When you see that after tapping, one dot of the medicine is coming on the top of the needle, so that time we have to little bit drop the medicine. Okay, so that is called creating an air bubble. After that, you have to gently administer the medicine, either in the muscle or in any site, means which is the preferred for the patient. Okay, so now come to the jet trap method. So jet trap method is nothing but it's the first we have to select the injection site. Okay, usually the large muscle like dorsogluteal or the ventrogluteal. Now come to the clean the area with the antiseptic solution, then creating a pinch and pull. Then we have to use one non-dominant hand to pinch the skin at the injection site, then we have to pull it on the arm side, and then we have to creating a taut space. So how we are creating a taut space? Suppose it's a hand muscle, okay, upper muscle. So what we have to do in the acromion process, we have to press our non-dominant hand, this two finger. Then we have to creating a V shape over there. So it's creating as a triangle shape, right? So the middle point of this triangle shape will be the exact site for the injection. Now come to the insert needle as a 90-degree angle. Then administer medication. We have to gently administer slowly and steadily. Then we have to withdraw the needle at the same angle where we are inserting. Then release the skin. After inject, we have to release the skin very slowly, and then we have to massage over there. Then apply the pressure to prevent the bleeding. After when bleeding will be stopped, we have to release the pressure. Now come to the subcutaneous injection. So subcutaneous injection is nothing but placing the medicine into the loose connective tissue under the skin. So what is the purpose? For the slow drug absorption, to administer the smaller dose, to obtain a prompt action of medicine, administer the medication which is ineffective in gastrointestinal tract by action of the digestive juice. So what are the equipment? Insulin series, hypernatremic needles, sterile cotton swab, methylated spirit container, kidney tray with a paper bag. So what are the procedure? First we have to read the physician order, then wash hands and select the appropriate syringe and needle, prepare the medicine, apply the spirit swab, then check the abnormalities over the skin, pull the skin and insert the injection in a 45-degree angle. Just remind, when you inject, this little bit pulling of the skin should be there, that is 45-degree angle. Then we have to putting the curtain on that particular side. Now come to the IV medication. So it's nothing but it's introducing the small quantity of the drug into the veins for the venous puncture. So introducing the drug directly into the blood circulation. Okay. So what are the purpose? To have the action of medicine on the bloodstream, fast action of the medicine, to give the medicine which is not irritating and ineffective when given by the other side. So what are the side? For the infant, mainly we are preferring the scalp head. For the dorsal aspect of the head, like brachial, cephalic vein or the metacarpal vein, and for the ventral aspect of the elbow or the foramedium cubical vesicular or the cephalic vein. Okay. So now come to the equipment. What are the equipment is needed? Tourniquet, ballet, water, jug order sheet, small sterile tray, water for the injection, file to cut open the ampules, methylated spirit in a container, syringe or needles of a various size, transfer forceps in a jar containing antiseptic solution, sterile cotton swab and gauze piece in a sterile container. So procedure: first wash hand. Then we have to check the orders, doctor's order, and select the medicine. Select the appropriate syringe and needle. Then we have to recheck the order medicine card with the label of the medicine and expiry date. Then mix well and take out the required amount of the solution in the syringe. Carry the medicine onto the patient. Carry the medicine to the patient. Then we have to apply the tourniquet over the upper arm. Then we have to ask the patient for the clench and unclench the hand. So what will happen? The vein will be visible. Then we have to palpate the vein, and then we have to insert the needle at a 15 to 45 degree angle, and then we have to check the black flow of the blood. Then we have, if it is black fluid present, means we have to insert the medicine. Then we have to apply pressure with a swab on the puncture site. After withdraw the needle to prevent the bleeding. Okay. So after care means we have to observe the area of your bleeding. If bleeding occurs, apply pressure but not massage. Give the comfortable position. Ask the patient to take rest minimum 15 to 30 minutes. Observe the patient for any kind of allergic reaction. Then we have to replace equipment, clean all over the articles and replace them, wash hands, and then record the report. So now come to the complications for the IV medication, that is pain, nerve injury, air embolism, allergic reaction, and then injection abscess. Okay. So in this session I discussed, I completed maximum important topic from the Nursing Foundation 1 and Nursing Foundation 2. Other than that, some more important topic is there, that is oxygenation administration, as well as the like pressure ulcer, comfort devices, etc. Okay, just look up this, and I hope you will crack the exam with our engineers team in a good way as well as good score. So thank you. I hope you all understood my session. Again, we'll meet in next session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you.